Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board certified family physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can watch Muslim Network TV on Fire TV, Roku TV, Apple TV, and Samsung Galaxy 19. You can also find us on our YouTube page at youtube.com/Muslim Network TV and on our website at muslimnetwork.tv. Today we have another exciting show. I know I say this every time, but today we're going to be talking about polycystic ovarian syndrome, or PCOS. It's a common disease that is misunderstood, and it's one of the most common causes of infertility in women. Joining us in that discussion is Dr. Vijaytha Rathnam. Dr. Vijaytha Rathnam provides gynecological surgery, obstetric services, and comprehensive care to women. She finds it truly a privilege to become an active part of a patient's short and long-term health plan. She has a particular interest in vaginal surgery, minimally invasive surgery, medical student education, and resident education. She was lucky enough to move around quite a bit growing up, having lived in multiple parts of various countries like France, United States, United Arab Emirates, and Qatar. Has helped cultivate her confidence, language skills, and cultural sensitivity. This has helped her efficiently build rapport with patients, gain their trust, and thereby create therapeutic bonds. She is fluent in English, French, and Tamil. Welcome, Dr. Rathnam.
Hi, thank you so much for the wonderful intro.
Absolutely. What an impressive resume or CV that you have. I love that you are multilingual. That must be really an asset in taking care of your patients.
It really helps. And I happen to be practicing just 20 minutes north of Seattle, and we have a really diverse patient population here, and it's really helped with not just language, communication, just understanding where they come from and what their needs are. And it's been wonderful. I'm really appreciative of all the opportunities I had growing up. So,
of course. That always plays a part. It's not just about the medicine, but it's gaining people's trust and being able to speak to them in their language is a big part of that. So that's great.
Yes, yes.
So as you heard in the introduction, we are here to talk about PCOS, polycystic ovarian syndrome. A name that I think, a disease that I think is misnamed or not adequately named. I think there's more to it than just that. And a lot of women, when they hear that, in my experience, a lot of my patients are very depressed and very anxious about that diagnosis. And I think a lot of that comes from misconceptions and myths about what it is and what it's not. So let's jump in by describing what PCOS actually is. I'd love to hear that from you.
And you're actually completely correct. I think even the name polycystic ovarian syndrome is a more recent terminology we use. It used to be called a disease. It used to be called all these other things. It is poorly understood, even within the OBGYN community. It's the knowledge of it is variable. I think when patients get the diagnosis or have the suspicion that they have polycystic ovarian syndrome, they look to the internet, and the internet has all kinds of information, sometimes terrible information that doesn't necessarily apply to them. And so the number of times patients come to my office crying because they recently found out they have polycystic ovaries, or incorrectly diagnosed, it's quite astounding. And I know part of my job, apart from, of course, diagnosis and treatment, is also education. And it's manageable for sure. And there's so many aspects to consider when we're talking to patients and educating patients about polycystic ovaries.
Exactly. I love that you are really drilling in the point that it is manageable. It's not, not to sound dramatic, but it's not a life sentence. It's not something that each of the symptoms of polycystic ovarian syndrome can be managed. That's exactly what you said. And I completely agree with that.
Yep.
So let's talk about what are the symptoms, how it's diagnosed, because for those of our viewers who may not be familiar with the term, or maybe having the symptoms of PCOS, but don't have a name for it, that might be something helpful for us to kind of go over. So let's talk about symptoms and how it's diagnosed.
Thank you. So there are multiple different diagnostic criteria for polycystic ovaries, but the one that's commonly used in medicine is something called the Rotterdam criteria.
Mm-hmm.
But essentially, you don't even have to meet too many of the aspects of like the list on Rotterdam criteria to even be diagnosed with it. So it's not a perfect, diagnosis, but the crux of polycystic ovaries are people with anovulation or irregular periods, which is probably the most common presenting symptom, just irregular spaced out periods. The second criteria is when our hormones are abnormal, and specifically our testosterone. So women have testosterone too. And so this, in the Rotterdam criteria, they say it could be a blood test that shows elevated testosterone or just symptoms that suggest elevated testosterone. The third aspect we focus on is the ultrasound findings. And this is where a lot of people falsely think that they have polycystic ovaries because the name suggests that the cysts are the most important part of the diagnosis, but it's really not. There's a very specific ultrasound criteria, but if we find multiple tiny, tiny cysts on the ovaries, that is another one. That is the third criteria on the list. And then the fourth is the most important, surprisingly. So there's the irregular periods, the elevated hormones,
Mm-hmm.
and the third being ultrasound. But the third is we've looked for any other causes of the above three, and we weren't able to find a reasoning for those three symptoms. And once everything else has been excluded, we say, oh, it must be polycystic ovaries.
That's interesting because when I learn about PCOS and treat it, I hear the first three all the time.
Yeah.
But to be honest, this is the first time I want to say that I have heard that last criteria, which is kind of that it's a diagnosis of exclusion. After we've ruled other things out, then we say, okay, you have PCOS. So that's really interesting to share because a lot of people jump to that conclusion, but it doesn't necessarily have to be PCOS. Your doctor may look for other things first, and having found nothing else, they say, well, we think it's PCOS. Is that correct?
Correct.
Okay,
and to make things a little more complicated, not everybody presents with elevated, hormones. Not everybody has the ultrasound criteria. Not everybody has irregular periods because maybe they're inadvertently treating it, or maybe they have a very mild form of it. And so it's important to keep our eyes peeled. In fact, even in the Rotterdam criteria, they do say that all you need is two of the four, or I guess two of the three to label someone as PCO. But I always tell my patients, I'm like, listen, have a little patience with us because it's not the easiest thing to diagnose, but we do our best. So
absolutely. And just to clarify as well, when you talk about I think it was the first symptom, which is signs of elevated testosterone, just to be clear that you're talking about excessive facial hair or body hair, male pattern baldness, maybe acne. Would you agree that those are all some signs that patients would know that they may have elevated testosterone?
Absolutely. And, keeping in mind that there are other reasons for acne and increased hair growth. So even by ethnicity, there are some ethnicities that tend to have a larger follicle count, like they just have more hair, But when
Arabs,
you talk about Indians, and so hirsutism specifically talks about, virilized or viralized hair. So it's not the soft hair that grows on our body. It's the more spiky, coarse hair that men's beards have, for example, but it's that texture. And that's the hair that grows in response to hormones. So there's more to every symptom. So.
I know there are like layers upon layers.
Yep.
And so this is why it's really important, as you mentioned in the beginning, that patients need to Google with caution. And I've said this in my other episodes as well. Google with caution, because there's a lot of information on the internet and not all of it is relevant to you, first of all.
For sure.
And second, not all of it is taking into consideration other factors. It's not always as black and white as Google would have us believe.
Yes.
So thank you for that. let's talk about, now that we've have a basic understanding of what it is and what are the symptoms to look out for, let's talk about how common it is, because for the average woman, thinking that this may or may not affect them, let's talk some numbers so that we have a clearer understanding of how common this is.
Mm-hmm. It's quite high, the incidence or prevalence of this. And so, part of the problem is we might be in some ways overdiagnosing it, in some ways underdiagnosing it. So it's hard to know what the true incidence is. But, and it definitely varies from, depending on what group of people we're talking about, ethnicity wise. But the NIH says about 7 to 10% of women, which is already 1 in 10 women. I suspect it's much higher for women from other parts of the world.
That's really interesting. So it definitely is significant, right? If you're saying it's higher than 10%, that's 10 in 100 women. That's definitely significant. So the odds are with those symptoms, if everything else is ruled out, that PCOS is higher than we might be thinking, or maybe lower depending on ethnicity, as you mentioned. Mm-hmm, mm-hmm. So let's talk a little bit about what the implication for PCOS is on women's health, right? Because there are some things that can affect as far as insulin resistance, risk for endometrial cancer and things like that. So I know it's a really broad topic to broach, but let's try to address some of the more common things that our patients and our viewers need to know about when they are diagnosed, and things they can discuss with their own doctors.
Correct. And so I do spend multiple appointments talking to our patients about polycystic ovaries, because the implication, so even the diagnosis is complicated. Imagine the steps after that. And so, I think the main issues, we'll talk about it generally, but the main issues are the abnormal bleeding, the question of infertility, the question of cosmesis. So people sometimes are not happy with their appearance. And then there's the health implications. There's the insulin resistance that leads to, long-term effects. And so I always talk to patients depending on what their goals are. But for example, one of the more important reasons to control someone's bleeding, to make sure they're having menses every month, or at least we're altering it in a safe way using hormonal methods, is because when the cycles are completely unregulated in the long term, women can end up with heavy bleeding one day, or end up in the ER with blood transfusions, which I've seen because I also work in the ER quite a bit. But there's endometrial cancer, which is when the lining of the uterus eventually just misbehaves from all the chaos from the prior years. And so, and that's just talking about the bleeding. Mm-hmm. When we're talking about just, if someone is trying to conceive and they have polycystic ovaries, then we have to talk about ways to help their fertility and kind of optimize it. And let's say people don't have many, just regardless of the population we're talking to, whether they're trying to conceive or not, we have to address the metabolic syndrome that can ensue. And so diabetes testing, frequent appointment, like letting your primary care physician know you have polycystic ovaries. It's not only a fertility issue. There's a couple, it ends up being multiple doctors managing different aspects of it.
Absolutely. We talked about, I love that you said that. I've talked about that a lot, or other times on my show as well, that with a lot of medical conditions, it's really important to coordinate with your specialist and your primary care doctor, or if you're seeing multiple specialists, because when everybody knows what the other doctor is doing, they can coordinate your care better. There's not going to be any contraindications or what do you call it, adverse reactions, because this side here is doing something unknowingly that this side is also doing something to maybe help your situation. And so a lot of the times, or sometimes rather, the medications that you might be getting from the different providers, if they're unaware, if each provider is unaware, that can definitely cause some issues with your health. And so it's important with any disease, there's a multiple system approach and a multiple specialist approach. Sometimes it's important for everybody to know, to be on the same page. So that's a really good point.
Absolutely.
I want to go back, Dr. Rathnam, to your comment about birth control. Let's go back
Yeah.
to that first. A lot of women may be hesitant,
Yeah.
even if they're not trying to conceive, to go on birth control. And when you talk about the specific treatment or management for PCOS with birth control, you're not talking about any general birth control. You're talking about a specific kind, correct? Because we know that there are different kinds of birth control.
Yeah, and so I think the birth control topic, it's a very common discussion I have in my clinic because there are a lot of misconceptions with that as well. And I think part of it is because just a generation or two ago, we didn't have that many birth control options or hormone options, and maybe people didn't pay enough attention to, to understand about women's health enough a couple of generations ago. And so, I mean, I can see where the myths and kind of misconceptions come from. But I mean, even in my own family, it's all educated people, but that when it comes to the H word, people get really nervous. And I think the goal with women with anovulation or just irregular menses, especially in the context of polycystic ovaries, is we're trying to create some sort of normalcy for the period. So maybe it's nice to have, maybe this person's bleeding too much, so then we would choose a birth control that would decrease the volume. Maybe this person is sick and tired of the irregularity. We would choose a birth control that would help with that, with some sort of predictability. My goal is to make sure that lining of the uterus is not building up. And so, not to get too technical, but when we have irregular periods due to hormonal issues, there's other hormones that come into play with this, not just polycystic ovary related hormones. Our lining with time gets thicker and thicker and thicker, which is not good. We like when that uterus flushes out every month or stays in a constant flushed out state. So there actually isn't one particular birth control that we prefer. I think that we have enough options these days where we can kind of offer about 10 options now to see what works with their fertility needs, their future plans, what their needs are right now medically. But the key is keeping that lining thin inside the uterus, whether it's once a month or for longer periods of time.
Absolutely. I wanted to make sure, I guess what I was trying to get at is with respect to would IUDs and Depo be an option, or do you recommend a birth control, combination birth control specifically?
Right.
Yeah.
I tend to prefer combination birth control only because and combination birth control means it has two hormones in it, estrogen and progesterone, much like what our body makes. And the estrogen and progesterone specific to the polycystic ovary population, it helps kind of regulate our hormones. It decreases our testosterone by increasing some proteins in our body. And on top of that, it also regulates our periods. And but there are some people that either don't like how they feel on combined birth control methods. There are pills, there's a patch, there's something called the NuvaRing you can place vaginally. Some people don't like them and it doesn't fit their, like they get nauseated, for example. And so if that isn't an option, we also talk about progesterone. Progesterone cuts right to the chase. It cleans out the uterus either for long-term or periodically. And correct, IUDs are a fantastic method of protecting that uterus. And so there are so many options. I wish we had more options, but we have a few options.
We've come a long way though, right?
Yeah.
We've come a long way, but there's
Totally.
always room for growth. I mean, we definitely need more studies in women for sure.
Exactly. I always tell my patients, like, it's, there's some people find their perfect birth control, regardless of what context we're talking in. But, some people, it's kind of like choosing what, kind of weighing the pros and cons and going and deciding whether you want to go for it or not.
Exactly.
We have like so many birth control pills out there, not to mention the progesterone options, the implants and the patches. But we need, maybe ideally in the future, who knows, we need something more customizable to individual hormones and lifestyle, but we still have a long way to go. But we do have plenty of options right now. And so
And that's the important
discussion
message.
to
Yeah.
have.
And that's the important message we want to put out, is that you don't have to be stuck with one form of birth control just because your doctor says you should be on birth control. Doesn't mean that you're limited to one, and that if you have a bad reaction or you're unhappy with whatever choice, that you're stuck. There are options. So that's the important message to get out.
For sure. And everything's reversible. You're not stuck with any birth control forever. And birth control is safe as long as you're using it under the direction of a healthcare professional. There are a lot of myths out there, and go to your OBGYN or your pediatrician or your family medicine doc, and we're happy to bust those myths because we want to help. So
exactly. And one of the myths that I get a lot, or questions that I get a lot of, and you may get this a lot as well, is the long-term effects on fertility and the effects of PCOS on fertility as well. And so I would love to jump into that next, but before we do, we're going to take a short break.
Okay, thank you. Sounds good.
You're watching What's Up Doc on Muslim Network TV, and we'll be right back after this short break.
Assalamu alaikum. My name is Adam. You remember me? I appeared in so many episodes that Sound Vision has put on the market. No matter what. Hey, what's happening? Hey, oh, sorry. Lockdown is what it is. Well, continuing here. In this lockdown, Sound Vision never stops thinking about you, the viewer. We'll have to get back into production again, online and inline. Everybody in their own space, even me. Although I'm stuck with Lanisa.
Salam! Salam! Salam!
I know, you were shocked too. Well, let me continue. This is what I was going to say. Salam! 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 Cut! 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 Finally, I get my own screen time again. Thank God. And so we invested in new equipment to bring you even better production with new songs and new singers and animations. Well, here are a few clips. And Sound Vision has brought all this into your home, making Islamic values and teachings easy. And if you know me, Adam, a multi-talented actor, well, sometimes I'm an actor and the reporter and the... Oh, that's enough. Let's move on to the next section. Well, you can watch these new episodes on our new app at www.adamsworldapp.com. We have previews happening every day on Muslim Network TV. Sound Vision has been serving generations, moving and changing with the times. We are all faithfully connected. That is a huge blessing. Your donation helps keep these programs available now and into the future. We take this job of helping tomorrow's Muslims today seriously, and you should too. Today, we need your help. Children absorb and learn from everything they encounter. Make that wholesome, positive, grounded in our faith. Together, we can accomplish our goal of raising better Muslims, better neighbors, and better citizens. Please donate generously.
It's an investment in our future.
To finish, let me tell you, there are new scripts of my new mission. And it is something that I enjoy talking about. My new mission is space. Houston,
We do not have a problem. Salam. See you soon.
Welcome back to What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and today we are joined by Dr. Vijaytha Rathnam, and she is a board-certified OBGYN, and we're talking about polycystic ovarian syndrome, or PCOS. So before the break, Dr. Rathnam, we were talking about infertility, and I think this is such an important topic because there is such a stigma around infertility. It's something that women seldom like to share, something that they feel embarrassed about and ashamed about, unfortunately, when a lot of the times this is something that is really beyond a woman's control. So let's talk a little bit about that stigma and how you see and address it in your practice.
And, I think this is part of the reason a lot of people feel quite upset when they think that they have polycystic ovaries. They feel like that's it for them. Not to mention the cosmetic implications too. So there is a lot of mental health issues. There's a higher kind of co-diagnosis, I guess, of depression or anxiety when people are diagnosed with polycystic ovaries, or specifically with fertility issues with polycystic ovaries. The main thing I focus on is that a lot of things are reversible or can be optimized quite a bit. Yes, I don't give false hope, but there's a lot of hope, And so part of the reason we don't ovulate every month, or part of the reason we don't have we have higher infertility is because of the ovulation pattern. And so if we don't have periods every month, we're not going to be ovulating every month. And so one of the focuses of treatment is to help regular cycles occur. And because we know that the irregular cycles are occurring because of a hormone imbalance, the focus actually becomes fixing that hormone imbalance. A lot of polycystic ovaries is driven by our lifestyle. And it's a little bit of a tough pill to swallow for a lot of people. And we never mean it in a blamey way. There is, it is something, people frequently misunderstand it as me saying, oh, you did this to yourself. No, there's a genetic component. There's an environmental component. There's a luck component. But once we have that diagnosis, I think changing our lifestyle can help quite a bit. And, we are at higher risk of metabolic syndrome with polycystic ovaries. So I kind of digressing a little bit, but lifestyle changes are so important. So there's no like ideal diet for PCOS, but we talk a lot about diet modification. I tend to talk to people about kind of doing like a pseudo diabetes diet or like a insulin resistant diet. All doctors will say something different, but something that can help with weight loss. I think of it as if insulin is really high, if we have high insulin anyway in polycystic ovaries, why not try to help that with our diet? Apart from that, exercise as well is very, very helpful. Cardio and resistance, both of them work differently. Once those two things are done, most people will notice a little bit of weight loss. It is a little more difficult to lose weight with polycystic ovaries, but it happens. And once that happens, our hormones start shifting. And some people feel that the difference. They go like, "Oh, I feel a little different," Who knows? Maybe the exercise and diet changes are helping their mood. Maybe it's really a hormone shift. We don't do specific tests to check if your hormones have shifted. But, people notice that their periods get a little closer together, and then maybe they start feeling other symptoms of like actual cycles. And so people feel a little breast tenderness or maybe a little crampiness that suggests that they're ovulating. And so whether we're talking about fertility or periods or metabolic syndrome or whatever it is, when it comes to polycystic ovaries, I spend a lot of time talking about lifestyle changes. That is the first step for sure.
That's really important.
Yeah.
Again, I love that you're reinforcing a lot of things that I say on the show already, which is, in this case specifically, is with any condition or health issue, if you look at it from a approaching it from multiple directions, which doesn't always and only include medication, but looking at lifestyle. And so that again goes back to, as you mentioned, diet and exercise. There are very rarely are there conditions that diet and exercise don't affect it. And when I want to clarify, because when I use the word diet with my patients, they think I mean to go on a diet. And culturally, that means to starve themselves, right? Or deprive themselves of something in their eating style in order to lose weight. And what I mean by that is the way that we eat. And so we mean a healthy way of eating. And so that includes balanced eating. A lot of patients don't think about vegetables and fruits as being part of that. We worry about carbs, which in PCOS there may need to be, may need to have to actually watch your carbs, because as you mentioned, of that insulin resistance that exists with PCOS. So that's maybe a little bit different. So talk to your doctor for sure about some of the things that you might want to avoid when it comes to that. I do want to, before we move on, to talk about diet a little bit closer, because there are different things that, well, actually, you know what, let's jump into that first. And we'll go back on to medications. With respect to diet, I've heard a lot of different things from experts, and everyone's an expert of their body. So I understand that if you feel that avoiding specific food makes you feel better, absolutely avoid that food. But is there any evidence to suggest that avoiding dairy or gluten, different food groups, for example, and you might have already heard about some of these, is there any evidence to prove or to support that actually helps with PCOS?
No particular study that I'm aware of, but to be honest, I've read a lot of different things about this. And so it's absolutely correct that, you got to do what you feel is best for your body. Definitely not trying to tell people to starve themselves. So it's good that you emphasize that. It's, a lot of time it's about some people call it like avoid inflammatory foods, but I really think what's important to convey to patients is like, put good quality food in your body if you can, if you're able to afford it, if you're able to put time, and so a simple change I tell a lot of my patients, which works for a lot of different ethnicities too, is, avoiding simple carbs and replacing it with complex carbs. And, so maybe a little extra quinoa, maybe a little extra brown rice, or fruits as a source of sugars instead of a,
A cake.
and some people are already doing that when they come to my office. So they're like, actually, that's how I eat anyway. I exercise and diet anyway. So then I'm like, great, at least we took care of that, but we'll move on. People can still have polycystic ovarian syndrome even after doing the lifestyle changes. But the lifestyle changes can help so many people, because I feel like at baseline, we're all pretty not very good at eating. And so, we could always do better. And so cleaning up that diet goes a long way. People feel different. I follow my polycystic ovary patients for months and months in the beginning, and then, they come back for various reasons, for other issues, but or for good news, maybe they get pregnant. But the initial couple of months is so important, because there's a lot of learning and trial and error when it comes to diet and exercise, and what helps them lose weight, and what doesn't, so but yes, I think complex carbohydrates are helpful, avoiding simple carbs. A lot of people have spoken about avoiding foods that kind of just are inflammatory, and so some people can handle dairy, so that would be a good reason to avoid it.
Absolutely. I think the important takeaway is that there's no magic bullet. There's no one answer to that'll solve everybody's problems. And it's important to work with your physician, because and to have patience. And I know that's hard when you're hurting, when you are having symptoms and you feel like that you feel are very important. It's not to say your doctor isn't taking things seriously, but like you mentioned, sometimes it's trial and error, because there is no one fits all solution. And so your doctor is trying to work with you to really find the best solution for you. And that's something to keep in mind with the treatment and management.
Yeah.
So,
and if I just say one more thing, polycystic ovarian syndrome actually puts people at higher risk of gaining weight a little easier. One of insulin's job is to help us put on weight. And gosh, if we have insulin high all the time, it makes it harder to lose weight and easier to gain weight. And so sometimes, just explaining that to patients goes a long way, because they've been told their whole life that they're lazy, or it's their fault they're putting on weight. And they're trying. I mean, there are very few patients that are overweight that come to me and say, like, yeah, I've never tried anything in my life. There are people who are really trying. It's just, we need to try something different. And maybe when we explain things a little to people and explain how polycystic ovarian syndrome works, people go like, there is hope. There are people like me out there that actually try and have trouble losing weight. And so I think that's really important to discuss with our patients, because usually by the time they're referred to an OBGYN, they just feel like, I've tried everything and everyone thinks it's my fault I can't lose weight, or that I'm lazy. And that's really heartbreaking to hear, and I try my best to explain to them that, it's actually a little harder. PCOS kind of works against us. It's almost like we have to be on a diet our whole life to just keep everything, balanced out. And so it is really a lifestyle change and not a diet. It's a lifestyle change. So
exactly. I love that. I think that's a really important point is that you make, which is to really shift the focus, because as you said, a lot of patients come in thinking that it's them that's the problem, and that why can't I lose weight? I've tried all of these things. And that's a really good point, is explaining and understanding that the nature of PCOS makes it harder for you to lose weight. And so hopefully that gives our audience a little bit, who do suffer with PCOS, a little bit of encouragement.
Correct. Yeah, correct.
Now, so we talked about diet and exercise as a way of helping with the symptoms, and that includes infertility. Let's talk briefly. We don't have to get into a lot of details, but are there medication options for treatment or management? And let's talk a little bit about that.
Yeah, it's good to touch on this topic. And I think, this is another area where I work with fertility specialists if patients need it, depending on who we're dealing with. A lot of people with just the lifestyle modification, a lot of perseverance, boom, their ovulation kits are turning positive and their periods are regular, which is always really nice to see. But then, there's a little debate. I'm just going to mention this about whether or not metformin helps with fertility. Metformin as a pill helps with insulin resistance. Very debatable, not FDA approved. But beyond that, when patients are still struggling with fertility, we talk a lot about ovulation induction. And so there are some pills, options available to help people ovulate, because no matter what they're doing, their body is just a little resistant to ovulation. And there's a medication called Clomid. There's a medication called Letrozole. Both very good. Have their pros and cons. So you have to definitely talk to your doctor to see if you're even a candidate for it. And then beyond that, there are fertility specialists in every neighborhood to help with more complex fertility conditions that come with polycystic ovaries.
Absolutely. Okay. That's really valuable information, Dr. Rathnam. I want us to continue this thread because I think we're definitely on a roll with sharing some really important gems.
Yeah.
But we do have to take a short break. You
Sure.
are watching What's Up Doc on Muslim Network TV, and we'll be back in a few minutes.
My wife, she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it, and spread the word, because the wisdom is there, so I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the U.S.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
Assalamu alaikum!
Open up your eyes.
Assalamu alaikum everyone, it's your brother Zain Bika from South Africa. One of the first educational programs ever produced for Muslim children was the ever popular Adam's World series. The colorful and comical Muslim puppets stole the heart of a generation. Sound Vision will be releasing brand new episodes of Adam's World with the launch of a Adam's World app. Subscribers will enjoy new Adam's World episodes as they are released, as well as all the classic episodes of Adam's World. So visit adamsworldapp.com now to learn more, subscribe, and enjoy new adventures of Adam and his friends. And let's keep helping tomorrow's Muslims today. Assalamu alaikum.
Adam's World. Believe me, there's a lot to see. Bismillah. Let's explore.
Welcome back to What's Up, Doc. I'm your host, Dr. Aalia Al-Barwani, and today we are joined by Dr. Vijaytha Rathnam, and she is a board-certified OBGYN. Before the break, we were talking about infertility and the different measures that can be used to treat or manage infertility, as that is one of the most common symptoms that we see with PCOS. Let's now talk about some treatment methods for the other symptoms that we talked about with regards to PCOS. And as you mentioned, that included the signs and effects of elevated testosterone levels or androgens. And so that would include the acne and the excessive, and we talked about a specific kind of hair, which we'll say is a thicker and coarser hair that women might experience. So let's talk about treatment options for that.
Yes, this is a really important topic as well, because this is another reason patients feel very self-conscious about themselves. You know, we patients care about these things. And so
not to mention, sorry to interrupt, but not to mention the societal pressure.
I was just going to say, I couldn't find the right word for it. That's what, yes, exactly.
Societal pressure to look a certain way, right?
Yeah. Yes,
men have beards, not women. Right? So there's definitely that aspect as well.
Yeah. So there's a lot of intrinsic and external kind of extrinsic factors that kind of drive this. And so, you know, the hair growth pattern that occurs with polycystic ovaries can cause people some grief, because it's not, you know, a lot of societies don't accept that, and patients are very self-conscious of it. It's a little harder to notice in a lot of people because we have all these great treatment options, but there's behind the scenes, there's a lot of work that goes into it. And so, you know, there's a little, I've read both things, like hair that's already grown under the influence of the hormone doesn't actually reverse. I've also read that it does get better, but definitely when we control our, when we make these lifestyle changes, further hair growth and further acne gets prevented. So again, harping on the lifestyle kind of point. But let's say we're doing all that and we want to fix the hair growth, you know, definitely a lot of permanent and temporary measures that we use in day-to-day life is so important. I reiterate that in the clinic. And so people do waxing and laser just to help with the hair growth. There are also medications out there that help decrease our hormone level. And, you know, there's creams that help decrease the hormone effect and the coarseness of the hair growth. But, you know, coming back to the point of contraception, and this is why I tend to lean towards combined methods, because combined birth control that has estrogen and progesterone in it, they drive that testosterone level in our body down. Also the lifestyle, but it really helps the testosterone come down. So a lot of people that are on birth control pills, the combined methods, they feel like their skin is clearer, the acne, the hormonal acne is gone, the hair growth is a little better. Sometimes dermatologists prescribe them too, and you know, and it really helps clear up that skin and kind of get rid of those symptoms that causes grief sometimes. And there are many pills out there that help with hormones as well. So definitely talk to your doctor to help with those things. Apart from acne and hair growth, there's also something called acanthosis nigrans, which happens when people's insulin levels are sky high. People see them with diabetics. And so it's when we have black patches of skin on our back, our neck, maybe under our arms or some folds of the body. And that can also be taken care of if you bring it up to the doctor. And once we drive that insulin level down, skin tends to even out as well.
Excellent points that you make. I really appreciate that, because we tend to focus on infertility because that's what is commonly shared about PCOS. But there are other things and other patients that might suffer from the different symptoms. So that's really valuable to understand. Again, like we've come a long way. We have a lot of treatment options. We have a lot of ways to manage the different symptoms that come along with it. Yes, it's a little bit of work, but you know, we can get there if you're working with your physicians. Absolutely.
Yes.
So I appreciate you sharing that.
Let's
talk a little bit. You mentioned earlier about the genetic factor of PCOS. And so when you say that, do you mean if there are other members of your family, then you may, maybe at higher risk? Or what do you mean when you mention that? Is there something else we should be aware of?
I think it's a little multifactorial, to be honest. I don't think there's definitely no like PCOS gene. There's nothing that gets hereditary in that sense. But, if let's say a certain family or household has a lot of diabetes in the family, yeah, the women in that family are very high risk for polycystic ovaries and diabetes, right? And so they kind of occur together sometimes, and so because they kind of feed off of each other. And so in that sense, yes, I think it's good to get a good family history. Endocrinologists are really good at doing this. Pediatricians are really good at taking this family history. I'd like to think OBGYNs are also very good. I was just going to say family physicians are
don't leave
also
us out, please.
phenomenal. Never will leave you guys out. And you guys are the all-in-one package. You guys are actually the most in tune with these type of things, because the specialists tend to focus on just the skin or just the female body parts.
Yeah.
And no, where would we be without primary care physicians?
Thank you.
So if anything, actually, I work the most with family medicine docs because it is multidisciplinary, and whether we make an endocrine referral or a dermatology referral, we got to get our family medicine doc involved, because they're probably one of the few docs that look at patients as a whole person. I hate to say it, except for me.
Except for you.
Except for me. But no, definitely our family medicine colleagues as well. So yes, I think it's not easy, and we have to explain that to patients, but it can be easy once we figure it out. So
absolutely. Now, as you were discussing the multiple, the diabetes risk factor in the family, that brings us to another important point, which is, yes, there's like a lot of this cosmetic and fertility issues, but let's say a patient doesn't care about those things, right? They're like, well, I don't want to have kids. I don't care that I've got a little bit of a beard, etc.
Yep.
Outside of those things, there are some real health implications. And we touched upon this a little bit at the beginning of our episode, but just to touch a little bit on it, because you mentioned diabetes, even if you're okay with all of the signs and symptoms, as you mentioned, metabolic syndrome, which affects our risk for diabetes, high blood pressure, cholesterol, our risk for cancer, all of those things people with PCOS are at risk for as well. So it's still important to come in and get treatment for PCOS, because you're still at risk for these other things. You need to be regularly watched because you have a higher risk of developing diabetes. And so I just want to kind of put that out there as something to still be aware of. There are other health implications to PCOS other than what we've touched on today.
Cholesterol, high blood pressure, mood disorders. The list is quite long. And central obesity comes from the insulin, which comes from polycystic. So there's like this whole network of things to address. And so again, education. I'm happy you're doing this show, because we get to get some information out there. It might help some people. But definitely, talk to your doctors, because there are, we shouldn't be, neglecting the fact that you have concerns that we're recommending birth control or recommending weight loss. We have to talk about these things, and birth control is safe if you use it properly, and if we're managing it appropriately. And no, it does not cause infertility in the future if used, which is a very common thing people think. They go like, oh, if I'm on birth control, I can't have children in the future. I mean, on the contrary, it really helps. It helps people get pregnant in the long run. And so there's just a lot of information. And I think it's very important to be patient with our patients and address all those things. Yes.
Exactly. I feel like we have covered quite a bit of ground, and I love the information that we were able to share with our audience today. Before we wrap up, I do want to know, because I get this question a lot as well, and that is with respect to supplements, over-the-counter supplements or vitamins that can possibly help. Is there any evidence behind that? I had a patient ask me specifically about inulin, whether that was going to be helpful because it might suppress appetite or reduce insulin levels, et cetera. What do you tell your patients? What do you want to share with us?
So this is a little bit of a topic that I feel like I could learn more about for sure, but I actually don't recommend many supplements. I think apart from the basics, like having a well-rounded diet, maybe having a multivitamin, but for example, for the reproductive medicine group, they have a lot of evidence that says that, there's a supplement called myo-inositol that helps improve fertility. I have to look into that, but I do know that my patients take them and they, it's just a supplement. It just kind of makes fertility a little more efficient. Definitely talk to your doctor before buying some for yourself. But apart from that, I think just general health. I don't have any supplement in particular that I know of that I should recommend.
Okay, perfect. So it sounds like the verdict is still out as far as anything conclusive, and there's nothing specific that will help PCOS, but general health supplements, if you're low in vitamin D or whatever, et cetera, just supplementing according to that. And most importantly, I would say, is making sure that your doctor is aware of any supplements you intend to take or are taking, because sometimes there are ingredients in there that may actually be detrimental and may be negatively affecting your condition. So make sure you bring that up with your providers as well.
And not to say supplements are bad. This is definitely just something I don't know much about, but definitely hope to learn about that soon.
Yeah, absolutely. Hopefully as more information comes out. Thank you so much, Dr. Rathnam. We had a great conversation today. I think, like I said, we touched on so many different aspects of polycystic ovarian syndrome. I really do think that we shared some really important information that patients can take in and then discuss with their own providers as well, which is the important part, is to collaborate with your doctor to give you the best health. So thank you again for your time. We really appreciate it.
Thank you for having me.
Absolutely.
Thank you for having me.
Absolutely. And we wish you every success, Dr. Rathnam.
Thank you. You too.
Okay. Thank you for joining us on another episode of What's Up, Doc. You can watch this episode along with our other episodes on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.